This is Brandon with CPR Plus. I'm here today to talk to you about pocket masks. October 2025, American Heart Association came out with the new recommended guidelines for doing mouth to mouth, or actually mouth to mask. I'm going to do a couple short videos showing you how to use it, showing you what I suggest. Hopefully this helps you. If you like it, helps you, if you learn something from it, share, give messages in the comments. I'll be happy to answer your questions, go over more, tell you where you can get yours, anything like that. So let's start. First off, these have been around for a long time, but it wasn't until last year where they actually have done studies and said that mouth to mask is more effective than mouth to mouth. You get a better seal. There's other reasons why I also think that pocket masks are more effective when giving a breath. So I'm just going to go over those. I'm going to show you what a pocket mask is, how to use it, and things like that. First off, when they come, a lot of first aid equipment comes. It's going to come in a package. I like to have my first aid, especially certain components that are critical, things that need to be taken care of more quickly. I like them to be unwrapped. I like them to be ready to go. So, first thing I always recommend is getting rid of the extra garbage. My masks come with adult and pediatric masks. Pediatric masks are normally going to be preformed. The valve's only going to fit on one way. The pointy part goes over the nose and then down over the mask, over the face. Sorry, mask face, whatever. So one of the two most common issues I see when people do CPR training is one of them is the airway. They don't head tilt chin lift. If you don't head tilt chin lift, the tongue's going to roll in the back of the airway, occlude the airway, and you're not going to get air in when you're breathing. So, give you an example with the mask. You want to push it firmly against the face, 2 hands. That way you get a better seal. When you give a breath, you only want to give a small breath. For an infant, it's going to be a puff of the cheeks. For a child, maybe half of your breath. For an adult, you are going to give your regular breath to the adult patient. We don't need to go, whoa! And even though I tell people that in training, they still very frequently blow hard. One issue with that is it either bypasses the lungs or inflates the lungs, and then it continues to inflate the stomach. The stomach fills up with air, and you get what I call the Capri Sun effect. That's why little kids have a Capri Sun, the little foil juice packets. They blow into the straw, they pull their mouth away, a bunch of Capri Sun comes out. Similar effect with this. If I'm blowing too hard in an adult, child, or infant, air is going to stand in the stomach, and it's going to encourage them to vomit. It's not Capri Sun that's coming out. So you don't want to blow too hard because you want to minimize the chance that they're going to aspirate or vomit. So to use a pocket mask, it's quite simply push on the face, do your head tilt chin lift. For an infant, again, it's just a small puff, and you can see how this works. You can see the chest just barely rise. I don't know if you can see the lung bags work. 2 small breaths. If they're doing rescue breaths, maybe they've got a good strong pulse, you're just going to give 1 breath every 6 to 8 seconds. That's how you use a pocket mask. Pretty simple. The most important part, 1, good seal, but 2, head tilt chin lift. Again, you're not going to get air in if you don't. Infants are a little bit different because if you crank their head clear back, you actually can kind of occlude or shut off the airway. So you don't want to do that. Adult pocket masks, a lot of times they have to be popped out and assembled. Put the valve in there, and there's the adult. You could use an adult mask on an infant. It's recommended to do an infant mask on an infant. The adult mask, you would just, instead of doing pointy part over the nose, you'd flip it upside down. That way the pointy part follows the contour of the chin. It's going to cover their whole face, but it's still okay. Another thing I see in CPR is people give a breath, and they take this off, go back to compressions, put that back on. That's critical time that's being wasted away from compressions. The masks will generally just sit on the face while you're doing the compressions. So just a simple reminder, just leave the mask in place. It's gonna make it faster and more efficient. and your hands-off time from compression is going to be minimized because you're not wasting a second or two to move that up to the face. If you have any questions, comments, concerns, make a comment in the notes and I'll reply back to you. Thanks for watching. This is Brandon with CPR Plus, and we're out.